Deputy Naughton.
Cahill, I want to compliment Una Smith and the Primetime team for exposing the reality of what is at the coalface in relation to our ambulance service in this country at the moment. We have wonderful staff working in appalling conditions. And I want to bring the Minister back to something he said here in the House on the 30th of June 2011. When the Minister stood up here in the House and promised the people of Roscommon that they would have additional ambulances, and I quote, so that there would be 4 ambulances covering Roscommon during the day and 3 at night. I can guarantee that there will be extra paramedics available with a car to provide cover if all the ambulances are out of Roscommon at any given time. These are services that I control and I will deliver. The Minister goes on to say, the abiding message that I want to send from this House today is that I want to replace that which is not safe with something that is safe. Now, Minister, the Primetime report exposed the fact that there has been a complete depletion of all of the ambulances in County Roscommon for extended periods of at least 2 hours on 10 out of 14 days that they actually analysed it. An expert that was interviewed on the programme highlighted the fact that clearly there were too little resources available to the people of Roscommon to meet their needs. Now, instead of addressing this issue, the intention is to spread these limited resources over an even wider area, with one of the Roscommon Town ambulances now to be relocated to Loughlin to provide a badly needed service to the people of West Roscommon and East Mayo. So we have already seen the loss of one of our ambulances servicing the county in Ballinasloe, which has been relocated 3 days a week from Ballinasloe to Tuam. And yes, we have a great air ambulance service, and that is to be welcomed. But people get heart attacks and strokes at night, and the only way the ambulance can be called in is if the paramedic calls it. Now, Minister, we have 3 nationally recognised ambulance black spots, and they all happen to be in the west of Ireland, in Mulranny and Mayo, in Tuam and Galway, and in West Roscommon, East Mayo. The government is spending €1.2 million on the Tuam base, 470,000 on the Mulranny base, and 70,000 on the Loughlin base, with no ambulance being made available, with no additional staff being made available to actually service those particular stations.
Thank you, Deputy Minister. You have 4 minutes to reply.
Thank you very much, and to thank the Deputy's opposite. We covered this area last week here in the Chamber, and again yesterday at questions time. And I understand that in different parts of the country different concerns are raised. But I do welcome the opportunity to outline again to the House the current position in relation to our pre-hospital emergency care services. The National Ambulance Service is working to ensure the provision of high-quality and timely emergency pre-hospital care services using all available resources as effectively and as efficiently as possible. As with any pre-hospital service, development and modernisation is an ongoing process as technology and clinical standards change. A significant reform programme is therefore underway, and additional funding of €3.6 million and 43 staff have been provided for in the 2014 National Service Plan. I believe it's important that we acknowledge that progress is being made. And in any event, new governance arrangements are being put in place to ensure timely assessment, diagnosis and initial management and transport of acutely ill patients to appropriate care. A joint review of Dublin ambulance services commissioned by Dublin City Council and the HSE will determine the best model of ambulance services for the city, though I know this doesn't concern any of the deputies here. In addition, an independent review of the National Ambulance Service capacity nationwide will determine the level and use of resourcing required in terms of staff, vehicles, skills and distribution for a safe and effective service now and into the future. I am confident that the reports of these reviews will inform the development of a modern clinically driven system properly resourced for appropriate and timely service to the benefits of patients. Deputy Kitt raised the issue of services in North Galway and South Mayo. The National Capacity Review as well as the HICWA review will be of importance in the context of the development of services outside the main urban areas and in particular the western area, which because of its rural nature and road network provides a particular challenge for response time targets. Of course, the counties in question benefit from the Emergency Aeromedical Support Service. This service provides rapid air transport of seriously ill or injured patients to an acute facility where the land transit time would not be clinically advisable. The Emergency Air Service has completed 556 missions since its inception in June 12 to February 14. The Irish Coast Guard also performed over 300 helicopter missions in support of the National Ambulance Service in 2013 and will continue to do so in 2014. I'd like to assure the House that the National Ambulance Service will continue to modernise and reconfigure its services to deliver timely and appropriate emergency pre-hospital care. The ongoing reform programme will provide a clinically driven, nationally coordinated system supported by improved technology. And just in relation to the comments of Deputy O'Keefe, re the golden hour, things have moved on in this regard. The critical period now is 90 minutes for somebody with an acute myocardial infarction or a heart attack that requires thrombolysis or bypass, which is now done through stenting. And all patients going into these centres can avail of this, and the outcomes have been hugely improved for people with heart attacks as a consequence. Stroke again has seen a huge improvement in terms of the number of people who receive thrombolysis. That's the blood clotting agent, the blood clotting busting agent that relieves their symptoms and has improved outcomes, saving a life a week at least and saving 3 more people a week from going into long-term care. We've gone from the bottom of the list in Europe for such procedures to the very top in a very short time frame of 18 months. Thank you.
Minister, thank you, Deputy. Deputy Nocturne. 1 minute.
Thank you, Les Kilcorla. Clearly, we were told on the primetime programme by Martin Dunn, the head of the ambulance service, that we are providing an excellent service to everybody in the West. Now, along with the northeast of the country, we have the worst response times in the country, with the biggest number of shifts that have been dropped, which means a loss in actual ambulances. And bizarrely, we also have the biggest underspend in relation to overtime. Actually, the only places that there are overtime underspends are in the West, the North East and the East, based on the first 9 months of last year. It doesn't include the scheduled overtime cuts that are taking place, with no cover for annual leave, no cover for long-term leave. Now, it's all well and good that we have fabulous uniforms, but we don't have ambulances, we don't have ambulance staff. And personally, I couldn't care less if the ambulance crews come to us with their knees out through the uniforms, if we have ambulances and we have ambulance staff. That has to be the priority, and I would urge you, Minister, to directly intervene in relation to this. I know you've taken a huge interest in it. I know that you have demanded that HIQA come forward with their report, but we need ambulances, we need ambulance staff now, and I would ask you to direct the National Ambulance Service to put ambulances and staff into those 3 bases, the only 3 nationally recognised ambulance black spots in Mulranny, in Tuam and in West Roscommon, and we need those additional services now. Thank you.
Minister, you have 2 minutes. Thank you, Deputy Minister. 2 minutes.
Yeah, I think it's important in the short time I have that I make it very clear that nobody who works on the ambulance service doesn't believe it can't be improved. It can be improved and it will be improved. But the real issue here, and I think Deputy O'Keefe has alluded to it, is the time to care. And that's why the early responder and pre-hospital emergency care advanced paramedics are so important. And that feeds into his other concern around the Order of Malta and others who are not trained in this way to deal with people in the same way as the advanced paramedics are, and why they may not be allowed to be used in as open a fashion as perhaps he might like. And that's not in any way to denigrate the people, and I believe we do need to look into the issue of raised deputy in order to see how we can best use the resources available. There have to be cases where they would be suitable for the Order of Malta to transport a patient that isn't acutely ill, but nonetheless needs to go to hospital. But I don't think we'd want them particularly to be looking after somebody with an acute heart attack and without the ability to cannulate the patient, etc., or other situations that do require the specialist expertise of the advanced nurse or the advanced paramedic. Can I just make the following point too, that, you know, in 2013, the HSE target for carrying vehicles to respond within 90 minutes was 70% for echo calls and 68% for delta calls. They're both life-threatening for different reasons. And for 2014, it's been raised to 80% for both call types. That there's been over a 1,000 per month increase in ambulance call-outs. And, you know, this has placed strain on the service. But nonetheless, they're only 1% and 2% behind those rates this year. And the government has increased spending on ambulance service both this year and last year. And whilst there was a reduction in the number of vehicles, ambulances per se, for carrying patients, there's actually more of them available to do that job now, because we've increased the number of vehicles to transfer patients between hospitals, thus freeing up those, and also the number of cars and motorbikes. So I believe that we are making improvements. I can understand that there's room for more, and we plan to make more improvements as time goes by. We want people to be reassured that they're able to get acute care when they need it. We fully realise and understand also that there are geographical parts of the country that are very difficult, with poor roads and isolated nature of where people live, that makes that very difficult to achieve. But we'll continue to strive to do that. And I think what Mr Dunn, if I may finish with this, really was alluding to is that our vehicles are of the highest spec, our staff are trained to the highest level, and they're the things that are important. And of course, the crucial thing is that they can get to the patient who needs them on time.
Thank you, Minister. The second.